Welcome to the RN Osce learning session. Today we will be doing a quick review of station number 5, Emergency Management and Overview. In this station, you primarily will be assessed on your direction and delegation skill. In addition, your psychomotor ability and clinical reasoning skills will also be evaluated. As always, begin by carefully reading the scenario. Jot down the key points in a ISBAR format. As you all know, this is a structured communication tool widely used to ensure effective interprofessional communication. Failure to follow ISBAR could be considered as a critical error. Before entering the scene, remember to collect the face mask from the outside table. Follow the DRS ABCD protocol step by step. The first one is look for danger. Ensure the area is safe. Remove any hazards if needed. R stands for check the response. Check the child's response by placing them on a flat, firm surface. And if unresponsive, send for help by instructing a bystander to dial 111 and bring the AED as early as possible. Meanwhile, check the airway for obstruction and assess breathing with look, listen, feel method. If not breathing, give 2 rescue breaths immediately. Begin high quality chest compressions as well. Once help arrives with the AED, delegate tasks by showing them. Place your hands on the chest. Push hard and fast. Operate the AED promptly and deliver a shock if advised. While assessing the airway for any obstruction and assess breathing with look, listen and feel method, if not breathing, you have to give 2 rescue breaths immediately by using this head tilt and chin lift method. Deliver each breath over 1 second. And make sure that you can see the visible chest rise as well. These are the steps of high quality compression. Push hard and fast. That means effective CPR applying strong compression to pump the blood through the heart. Hand ensures pressure to move blood and fast maintains circulation. Effective CPR by giving push hard and fast at the center of the chest will improve or it helps to pump the blood through the heart, and the heart should be compressed 100 to 120 per minute. Less than 100 that means that is not enough circulation. If it is more than 120 per minute, compressions become too shallow and less effective. And adults needs at least 5 cm depth to squeeze the heart effectively. It could be about 5 cm for child. Less than that, this depth that will not produce the blood to be pumped. And if it is more than 6 cm, there is chance of or risk of injury, especially in the ribs and internal organs. After each compression, allow for complete recoil and try to minimize the interruption. Every pause in compression reduces blood flow to the brain and heart. Try to keep interruption less than 10 seconds. While giving breath and while using the defibrillator. And always ensure that you are not providing excessive ventilation. That means if you are giving too many breaths, increases pressure inside the chest and decreases the blood return to the heart. The guideline is for a single rescuer, in case of child, you can provide 30 compression and 2 breath. Just enough breath to see the chest rise. And if it is related to multiple rescuer, you can provide 15:2. Once AED arrives, delegate the task by showing them place your hands on the chest, push hard and fast. At the same time, you have to operate the AED promptly and deliver a shock if advised. Once help arrived, with AED, you can delegate the task by showing them, place your hands here on the chest, push hard and fast, let me operate this AED promptly. So once you've got this AED, turn on the AED first, apply the paddles, just below the right clavicle and few inches below the armpit, and connect the cables without any delay. Once connected, AED will start analyzing the rhythm. And if it is a shockable rhythm, you have to give shock within no time when it's got charged. And if it is a non-shockable rhythm, you can continue CPR as early as. When you hear the ambulance approaching and paramedics arrives, give a structured handover. During practice, keep a timer to ensure proper rhythm and timing, which is a structured communication tool commonly used in healthcare to ensure clear, concise, and effective communication between the healthcare professionals, especially in emergencies or critical situations. Here, I stands for who are you, introduce yourself and name of your role. And who is your patient, identify the patient by clearly using the name, age, and ID if you know. And make sure the right person is addressed. And S stands for what's happening right now. State the immediate concern or problem with the patient. For example, when you saw the patient was unresponsive. And if any relevant background history, you can provide essential medical history, diagnosis, or any recent events leading up to the current situation. If you have any idea, you can verbalize. Upon assessment, have you noticed any changes? Like number of compressions and ventilation cycle, number of shocks delivered, any rhythm change you noticed during this assessment? And finally, what's your recommendation? That means what's your clinical impression or what is your request? Suggest that what you think should be done next or ask for specific help if needed, intubation support, prepare for transfer to ICU, or you can ask for continuous advanced life support. Be prepared to give your own version of the answers while ensuring you do not miss the essential points.